started to use phakic IOL a long time ago, I think around 2008, but I started with the iris closed lenses. The doctors and the patients are more confident with this kind of treatment, and maybe even because with the standard LASIK we do have some sort of ectasia in the post-op, and especially for medium height myop, so we switched to the phakic lens in order to avoid this problem. Refractive surgery, in my opinion, should manage every kind of operation. So when the parameters don't convince me to perform a corneal refractive surgery, I switch to phakic IOL. Procedure is reversible, but it's very rare that we have to reverse the surgery, only in the case in which the sizing of the lens is not perfect, so, but it's less than 1%. So it's a safe technique, and for sure, I think that they are safer in the cornea that are borderline, for example, and if you perform a refractive surgery on the cornea, you could have in the future an ectasia. I think that is growing and will grow because of a lot of patients now are more interested in refractive, and a lot of doctors are more confident with the phakic IOL. So I have a lot of colleagues that before didn't perform phakic IOL, but now with experience, now it's a long time that we are treating patients with a phakic IOL. A lot of doctors are more confident. They enroll more patients for this. I think, okay, we have to study maybe other materials, or other geometrical design. There could be some additional for presbyopia. I think that could be the new improvement of this kind of lens. So I think, in my opinion, could be nice to develop an EDOF lens. Okay. An EDOF phakic lens. We were expecting this, to have more competitors, to a new company that sell and build these lenses is a stimulus for everybody. The surgeon can try the one or the others, and they make an idea which is going to be the best or the more suitable for him. Obviously, the benefit is even for the patient here. Of course, the best advertisement is the patient that is happy and communicate to other patients, oh, my life is changed, I am happy. I think that for the high myopia, the gold standard, the benefit that we got with the phakic IOL are enormous. High quality of vision that no eyeglasses or no contact lens could give to you. So, for example, minus 15, minus 20 of myopia. If you insert a phakic IOL in a patient like this, he will be so happy that you cannot imagine how the people are great to you. The moment when the patient after the operation, the day after, say, oh doctor, I never see like now.